And with that, we're going on to flu shot awareness. Cheryl, you taking care of that, or is Kathy doing that? Cheryl, yes.
All right, this is a great way to start off the first day of fall since we know influenza season is just around the corner.
We should have done this at the end of the meeting in case some of us faint. So.
Kathy, would you please come up here just in case someone faints? We'll have the sheriff come up there and catch anybody that. Funny. Who would like to go first?
I volunteer.
Okay.
What a hero.
Paskey, that's enough on you.
Peanut gallery. The peanut gallery.
Okay.
Smile.
I can always smile.
Any Tito's in this?
Keep the arm relaxed.
As Cheryl is providing the shots, I'd like to just let the public know that the influenza vaccine it's always important every year, but it's very important this year because we'll have two circulating viruses. We'll have influenza, and then we'll also have the coronavirus circulating at the same time. So we're really recommending that people that haven't ever received a flu shot, be sure this is the year you get the flu shot. You definitely do not want to get the coronavirus along with the influenza. That would be a double whammy. So it'd be pretty detrimental to your health. So the influenza virus will protect you, the influenza vaccine, excuse me, will protect you from the worst strain of influenza. So we're highly recommending people get it. Now is a good time. We're starting this month just because it's a good time to start earlier before the coronavirus vaccine is available.
Right. We can probably start the update too while we're waiting.
Okay. Okay, while that's going on, we'll do the the COVID-19 update by Kathy McKay and Jamie.
Good morning, Mr. Chair and Commissioners. Please don't cry when you get your flu shot.
I am sympathetic if you do.
So I believe you all have the numbers of our current cases. The new total for Minnesota is 90,942. That is up 937 from yesterday. Sunday's total was the new one-day record high in Minnesota. And then our Clay County numbers, we have 1,281 positive cases. We're still at 40 deaths, so we haven't had any additional deaths for a number of weeks. And then we have 3 hospitalizations. Across the state, there's a number of other hospitalizations, but nothing significant as far as the healthcare systems are able to handle all of the hospitalizations from COVID. And so you'll see our case numbers, our positive confirmed cases are rising. This was expected to increase, of course, with the higher ed coming back into our community, all the students, and then we're seeing a number of cases in our K-12 schools as well. So the unfortunate thing is most of what they're seeing actually even across the state and we're seeing here is the reluctance of people, and it's COVID positive adults or parents of COVID positive children. They're reluctant to share the information. Our case investigators are noticing that, as well as the schools are noticing that they're not wanting to share even the kids that are exposed to positive cases because it means that they have to be quarantined and they have to be out of school, and that's a hardship for parents. So we understand why they're not willing to share that, but it does make it harder for Minnesotans because it boosts the COVID spread to others in the school, your athletic teams, your churches, your workplaces, and some people will be at higher risk for complications. And you know, we're all not wanting to deal with the disruptions of COVID, but we need to make sure that we follow our individual responsibility, and that is, if you are positive, you stay home for 10 days unless your symptoms don't resolve within that time. If you're a contact of a positive, you need to quarantine, and that's 14 days, and you can't test out of quarantine. So we've had some people say, well, I'll go get tested on day 7. If I'm negative, then I can go back to my usual work and or school, and you can't do that. If you're a contact of a positive, you have to quarantine for 14 days. Regardless if you get tested on day 7 and you're negative, you really still must maintain that quarantine because that's the time period where you'll become symptomatic. So we want to make sure that people understand that it is our responsibility, all of us, to follow the guidelines to slow this spread and stop this from circulating. We all have that responsibility. So wearing your mask, make sure you follow the guidelines for quarantining, and if you're positive, and please let our case investigators know. If we don't know who the contacts are, we can't follow up with those individuals.
We got the sheriff's ready first.
Yeah. You want her to set up here?
Now, would someone watch so the sheriff does not fall over when he gets his shot? No crying, whining, or fussing.
You better do a good job, he's got a gun.
Cheryl, don't use that used needle on him.
My husband used to be a law enforcement. I gotta get all the way up here. If we can't get far enough, we might have to wait.
It's
close, but I don't want you to cut your arm off. Okay.
Don't look at it.
Be nice now, Cheryl, be nice.
You know,
You'll keel over, buddy.
It's the same treatment. You good?
Oh, yeah.
Let me put a Band-Aid on, see if I get any blood on that white shirt. It would be.
Good
It would
job.
ruin my reputation as well.
Thank you all for doing your part in getting your influenza vaccine.
So do we,
Oh, you did, okay.
do we notify our own?
What'll happen is it will go into our Minnesota immunization registry, and then all of our healthcare systems have access to that.
Okay, so it'll let you eventually get it downloaded to
Yep.
my care, my
Yep.
provider.
Absolutely.
But just make sure you tell them so they don't give you a second one in case they
Yeah.
they haven't looked at that.
What would happen if you get a second one? What-
Well, nothing, but we don't want to waste the doses on
Okay, very good.
getting a second dose.
So just out of curiosity, how many people here had to take the old people one?
Oh, Cheryl, you can't share that because of
Oh,
HIPAA.
you can't? Oh. Well, let me
Easier to
guess.
say
Let
how
me guess.
many
1, 2, 3, 4.
Meeny, miny, mo.
It's easier to ask how many you didn't have.
I think this would be
Well, I
Commissioner
can count to 4 and I
Whalen's.
can count to 2.
This is Commissioner Whalen's best birthday present, is getting an influenza shot.
I told him, you won't forget this birthday.
no.
No, the TV
You're gonna
count.
have to
Yeah.
replicate that,
Yeah.
Cheryl. You're gonna-
Too late, we already got the shots.
But you can replicate it, right?
I
Yeah, we
guess
can
we
figure
do, I guess we do get a second one.
Without using the needle, I don't know if I can,
You might
because
not
they're
be
all
for that.
pre-filled syringes, so
They might
I
not
have
be,
to-
maybe they're here for another deal too.
Oh, okay. Thank you,
Thank you, Sharon.
commissioners, for doing your part.
I'm always happy to post.
Thank you.
people.
And the sheriff as well for
We
doing
should
his
also
part.
probably say, do you have any upcoming flu clinics or?
I am still waiting on my state vaccine, Minnesota vaccine for children and that, and we do have more vaccine coming the first week of October. And so as soon as I have enough of that, I will be opening up a clinic for all of our campus employees. Thank you all.
Thank you, Cheryl.
Thanks, Cheryl.
Thank you.
Okay, now from the entertainment part to the regular meeting again.
And I went over those numbers as you were all getting your vaccine,
Yeah.
so I'm not sure if you have questions on those. We're still working with K-12 schools, and we're meeting every week to discuss their learning model. And we're also working with higher ed. We have weekly calls with them as well. We are looking at community testing. We're working on that information, and we'll get that out to the community once we verify with the Minnesota Department of Health that it is looking like next week we'll have an open community testing. And we'll get the flyers out and the information out so people can come to that testing site. It will be 3 days, and I think, or is it 4 days? Is it 3 days, right? 3 days, 600 tests a day. So we'll send a link for people to register for that site. It will be free to anyone that wants to get tested at that community testing site. So more information, we have a meeting tomorrow with Minnesota Department of Health to confirm and finalize those plans. Okay.
Can you talk a little bit about, we discussed this briefly yesterday, the door-to-door voluntary testing.
Yeah,
I
James.
know there's some misinformation out there and there's some people that are questionable or questioning it, so if you could update, that'd be great.
Perfect.
Okay.
Jamie's got
Kathy
that.
did ask me to talk about that, so I will. But if you have some specific things, then we can talk about that too. But before I move on to that, I just want to support what Kathy talked about, that when a person does go and get tested, they need to stay home. And so we are seeing that throughout the community when we're working with work sites in our K-12 and our schools, that people are identified, they get their test results, and that goes back for 48 hours for their contact. So as an example, if they get their test results on Wednesday, if they were at work or at school on Monday and Tuesday, those are contacts if they haven't been 6 feet from them. So it's a lot more work to track through who could have potentially been exposed and who would need to quarantine. So just a reminder that if you are tested, and most often it's people that are not symptomatic, but they go get tested, and then it ends up being that there's exposure in the workplace. And so just a reminder of that. And then also, if you do go to that testing site in the community, it would be the same thing. You need to wait for your results before you would go back to work or school. So then on to CASPER. So CASPER is the Community Assessment for Public Health Emergency Response, and it's a push across the state of Minnesota right now. It's a model that CDC uses and Minnesota Department of Health to kind of boots on the ground, find out what's going on in the community. So in this case, they're looking at, they've actually targeted 180 sites across the state, and they are providing an opportunity. It's completely voluntary. They're not contacting you in advance to see if you want to participate. But what they're trying to do is they're doing a test for COVID. They're also doing the antibody testing. And then one person of the household will complete a survey so they can gather information. The goal of this project that Minnesota Department of Health is implementing started on September 15th, going through the end of this month across Minnesota, is to understand how COVID has spread in Minnesota communities, to understand what caused COVID to spread in certain communities, to explore how transmission and infection rates differ among regions in Minnesota, to identify the percentage of people infected with COVID that have no symptoms, and to improve health messaging. So it's a team of public health professionals. There is a healthcare person that is employed by Minnesota Department of Health to do the testing. Their vehicles identify that they are the COVID-19 testing team by magnets on the side of their vehicle. Again, they don't notify you in advance, so they will knock on your door and ask if you're willing to participate in the survey. It is completely voluntary, as I said, and it really is giving people in the community an opportunity to ask questions, to talk about how COVID has impacted their families, and also to give them information to provide education as well. Just some kind of benefits for why people would participate in the survey. Again, really giving them an opportunity to speak directly with health professionals in the community and share their thoughts, their concerns, and also an opportunity for the testing. It is free, it's confidential, and voluntary. Okay, Commissioner Rojo, any questions about
I
that?
think it's just hard for people to understand how that's the safe alternative to get tested, right? If you have somebody going door to door, and I think there's a lot of questions behind it, and so just to make sure that we're getting all of the information out is important.
Okay, so basically they're showing up, with proper PPE. I guess I think of it like home care.
Right.
Home care professionals come to your home all the time. Whether we do that at the armory or we do that in your home, it's a safe and effective way of testing.
And
More
it
questions about
runs through the 30th, if
The
I'm
30th.
not mistaken, so September
through the
30th. There's an end date to it, so.
All right, thank you for that info.
Okay. Any other questions? All right, thank you very much.
Okay, thanks for the update again.